Lung cancer is the second most common cancer in both men and women in the U.S. St. Luke's screens more than 2,000 patients yearly for lung cancer and has a unique center for precision oncology to help patients through their cancer diagnosis. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. Today, we're talking about lung cancer and how precision oncology helps patients diagnosed with the disease with treatment. With me today is Dr. Dhurv Bansal. He's the Director of Thoracic and Precision Oncology at St. Luke's Health System. Thank you so much for joining us.
Lindsay, thanks for having me.
So first of all, there have been some recent changes in the screening guidelines. Can you tell us what the latest guidelines are?
Yeah, so NCCN, which is the National Comprehensive Cancer Network, came out with new guidelines recently where they recommend screening for everybody, regardless of whether you have quit smoking or not. In the past, we would not screen if you had quit smoking more than 15 years ago. So now if you have a 20-pack year smoking history, which is a pack a day for over 20 years, or half a pack a day for 40 years, you should get screened for lung cancer. Yeah.
Okay, good. Now, why is early detection so important when it comes to lung cancer?
Yeah, so the survival traditionally is based on the stage of the cancer we catch it in. And if you get screened, there's a higher chance that we detect the cancer at an earlier stage. Roughly at stage 1, the survival at 5 years is 2/3. When it's spread regionally, which is near the lung in the lymph nodes, the survival at 5 years is 1/3. And at 5 years, it's 1 in 10. So as you can see, it's very important to catch cancer early.
Absolutely. So what are you seeing at St. Luke's in terms of, when people are coming in and as far as early or late stage diagnosis?
So we have a very robust lung cancer screening program, which is led by our pulmonary department. And, we screen over 2,000 patients a year, which is really a big number, but roughly about less than 10% of people who need screening get screened. So we are seeing a fair number of early stage lung cancer patients, but the number can be really improved upon.
Okay, good to know. So St. Luke's Hospital has a Center for Precision Oncology which helps give more treatment options to patients. Can you explain what precision oncology is?
Yeah, so precision oncology is where we look at the genetic footprint of the cancer and match the treatment to the genetic footprint. I lead the team of precision oncology here at St. Luke's, along with some precision genomic pharmacists, a bioinformatics person, Dr. Roth, who's our GI oncologist, and a few other physicians. And we go through the genomics of the cancer and look at any treatment options. This is especially useful when we think traditional standard of care treatment options would not work, or we think that the traditional options are just not good enough.
Now at St. Luke's, do we offer genomic testing just for late stage patients?
We tend to offer it to almost all stages. It tends to be more useful in late stage patients, but recent data has suggested that even earlier stages patients benefit from genetic testing.
Oh, great. Now, in terms of treatment options for lung cancer, why is precision oncology so important in a patient's treatment?
So there are a lot of aspects to this. Firstly, immunotherapy is one of the mainstays of treatment for lung cancer. And there are certain mutations in lung cancer, such as ROS1, EGFR, and ALK, where it seems like immunotherapy does not work, or if it works in a very small subset of patients. So it's important to determine whether immunotherapy is going to work or not. Otherwise, the patient would end up getting a treatment that is futile for the next year or two.
Right.
So and then the treatment can have side effects. So we tend to tailor the treatments to the patient, and which is where genetic testing, even in earlier stages, is useful.
Okay. And you've noticed through your own research that survival rates have dramatically improved for early stage cancer patients as well with this precision oncology treatment.
Yeah, so we recently presented our data at European Society of Medical Oncology conference in Madrid last month, which showed that if providers follow our treatment recommendations, which is recommended through the Center for Precision Oncology, the survival is double of what it would be following regular treatment recommendations that are not directed by genomics. So yeah, it does seem to make a big difference.
Wow, that's fantastic. Yeah. Are there any new treatments on the horizon for lung cancer patients?
Yeah, there are lots of new treatments. Firstly, all the existing treatments are getting a refresh, which happens every 3 to 5 years. where all the current treatments targeting EGFR, ALK, ROS1, they seem to be getting better. And in the next year or two, we'll see a lot of approvals where the treatments are better, patients are living longer, and hopefully with less side effects. Then there are other targets that are drugs for them are in development. One of them is NRG1. So yeah, we keep chipping away at different targets at lung cancer, and nowadays almost half the patients have a targetable mutation.
Okay, fantastic. Is there anything else that you'd like to add today?
Yeah, so we have a very robust screening program. Take advantage of that. Quit smoking. That should go without saying nowadays, given the awareness around it. That's one of the biggest things you can do for your health is quitting smoking. And then we have a great precision oncology program here where we look at the genomics of the cancer and try and match the treatments to the patient, customize treatment to the patient, so take advantage of that. That's two services at St. Luke's that are offered by the great team we have here. I would recommend everybody take advantage of that.
Okay, great. Well, thank you so much for joining us. All very interesting.
You're welcome. Thanks for having me.
To learn more about precision genomics or to schedule a consultation, visit stlukeskc.org/precisiononcology. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.